Welcome back, everybody. Today, we're diving into something that feels straight out of science fiction. I mean, seriously, like a movie.
I know what you mean.
An AI that can, analyze chest x-rays and then have a conversation with you about the findings.
Yeah, it's pretty remarkable.
So
I'm talking about RadVLM,
RadVLM.
which stands for a Multitask Conversational Vision Language Model for Radiology.
Okay, that's a mouthful. But before we get lost in the jargon, can we back up a bit? Why is this even necessary?
Okay, so think about the healthcare system. There's this growing shortage of radiologists,
Right.
which means longer wait times for diagnoses and potential delays in treatment.
I see where you're going with this. An AI like RadVLM, it could help bridge that gap, especially in places where access to specialists is limited.
Exactly. And even in well-staffed hospitals, RadVLM could streamline workflows by acting as a first reader, quickly analyzing x-rays and flagging anything that needs a human radiologist's attention.
So it's not about replacing radiologists, but more like giving them a superpowered assistant.
That's the idea.
Okay.
But what's really unique about RadVLM is this conversational element. It's not just spitting out a report. It can actually engage in a back and forth with a doctor, answering questions and clarifying findings.
Hold on, an AI that can have a conversation about a medical image. That sounds like something I'd see in a movie, not in a real hospital.
It might sound futuristic, but that's the reality we're moving toward. To build this, researchers trained RadVLM on a massive data set.
Okay.
Over 1 million chest x-ray images, paired with reports, labels for abnormalities, and even precise locations of those features.
Okay, that's a lot of data, but how does it actually learn from all of that? It's not like it's just memorizing a bunch of x-rays, right?
Right, it's not just rote memorization. It's about understanding the underlying patterns and relationships within that data.
Okay.
This is where multitask learning comes in.
Multitask learning, that sounds intriguing. Fill me in.
Think of it this way. Instead of just training an AI to do one thing like classify an image as normal or abnormal, you train it to do multiple things at once. In RadVLM's case, it was trained to generate reports, classify abnormalities, and pinpoint their location on the x-ray.
So it's like taking a crash course in radiology, covering all the bases.
Exactly. And the researchers found that this multitask approach actually helps the AI develop a more robust and nuanced understanding of chest x-rays.
That makes sense. It's like learning a language. You don't just memorize vocabulary words. You learn grammar, sentence structure, and how to apply it all in different contexts.
That's a great analogy. And just like with language, the more you practice, the better you get. In RadVLM's case, the massive data set and this multicast training enabled it to achieve some impressive results.
Like what? Give me some examples.
Well, one example that really stood out in the paper was RadVLM's ability to accurately locate the aortic arch on a chest x-ray.
Okay, I'm going to need you to break that down for me. I'm not exactly a medical expert. What's the aortic arch? And why is it a big deal that the AI can find it?
The aortic arch is a major blood vessel that carries blood from your heart to the rest of your body. It's a crucial anatomical feature, and accurately identifying it on an x-ray can be important for diagnosing certain conditions like aneurysms or blockages.
So it's not just about finding a random lob on the x-ray. It's about pinpointing a specific structure that has clinical significance.
Precisely. And the fact that RadVLM can do this with such accuracy demonstrates the level of detail and understanding it has achieved.
Okay, color me impressed, but we're not done yet, are we? There's this whole conversational aspect we haven't explored yet.
You're right. Let's dive into how RadVLM actually talks about these x-rays.
Okay, I'm all ears. Laid on me.
So to train RadVLM for conversations, the researchers did something pretty clever. They used another AI called GPT-4o Mini to generate a data set of realistic conversations based on the x-ray information.
So it's like AI teaching AI how to talk about medicine. But how do you even teach an AI to have a conversation? That sounds natural.
Well, GPT-4 Mini is a large language model. Think of it like a supercharged chatbot that's been trained on a massive amount of text data. By feeding it information about the x-rays, the researchers were able to prompt it to generate these back and forth dialogues.
So they basically created a whole bunch of practice conversations for RadVLM to learn from.
Exactly. And then they used yet another AI, GPT-4o, to act as a judge evaluating the quality and accuracy of RadVLM's responses.
Wow, a whole panel of AI experts judging the conversation skills of another AI. Okay, so how did RadVLM stack up against the competition?
They compared it to other vision language models, both general-purpose ones and those specifically designed for medical imaging. And the results were pretty impressive. RadVLM consistently outperformed the others, both in terms of accurately identifying anatomical features and engaging in these multi-turn conversations.
That's incredible. So what's next? Where do we go from here with this technology?
Well, one exciting avenue is adapting RadVLM to work with other types of medical images, like CT scans or MRIs. Imagine an AI that can help doctors understand and diagnose a wide range of conditions from various imaging modalities.
Okay, now that's a game changer. We're talking about a potential revolution in healthcare, right? But let's get practical for a second. If we were to implement something like this in a real hospital, how would it actually work?
Let's say you go to the emergency room with chest pain. One of the first things they'll likely do is take a chest x-ray. Now, in a busy ER, there might be a delay before a radiologist can review that x-ray.
Yeah, I can definitely see that happening. ERs are always so hectic.
Exactly. But with RadVLM, the ER doctor could get a preliminary analysis of the x-ray almost instantly. They could ask specific questions about the image, like, is there any sign of pneumonia? What about a collapsed lung?
So it's like having a radiologist on call 24/7, even if they're not physically present?
That's the idea. It could help ER doctors make faster, more informed decisions, especially in critical situations where every second counts.
I can see how that would be incredibly valuable. And you mentioned earlier that this could also be a game changer for areas with limited access to specialists.
Absolutely. Imagine a primary care doctor in a rural community who needs a second opinion on a chest x-ray. With RadVLM, they could get expert insights without having to refer the patient to a specialist miles away.
That could make a huge difference in the lives of people who might otherwise face significant barriers to healthcare.
Right. It could help bridge that gap and ensure that more people have access to quality care regardless of where they live.
So far, we've been focusing on chest x-rays, but you mentioned that RadVLM could potentially be adapted to other types of medical images. What are some other areas where this technology could be applied?
The possibilities are really endless. Think about CT scans, which are used to diagnose a wide range of conditions, from cancer to stroke to bone fractures. An AI like RadVLM could help analyze those scans, potentially speeding up diagnoses and improving accuracy.
I can also see this being incredibly helpful in fields like cardiology, where they use imaging techniques to assess heart function. An AI that can analyze those images and provide insights could be invaluable.
You're absolutely right. And it's not just about diagnosis. AI could also play a role in treatment planning and monitoring patient progress.
Okay, let's pause for a second and address the elephant in the room. This technology is amazing, but it also raises some important questions. I'm thinking about the impact on radiologists. Are they going to be out of a job?
That's a valid concern. But I think it's important to frame this as an evolution, not a replacement. AI tools like RadVLM are designed to augment the capabilities of radiologists, not to replace them entirely.
So it's more like a collaboration, AI handling some of the routine tasks, freeing up radiologists to focus on the more complex cases that require their expertise and judgment.
Precisely. And I think this shift could actually lead to a more fulfilling and engaging career for radiologists. Instead of spending hours poring over routine scans, they can focus on the cases that truly require their specialized knowledge and experience. They can become more like medical detectives, using AI as a tool to solve the most challenging diagnostic puzzles.
That's a much more optimistic outlook than the whole robots are taking over narrative we often hear.
Right. And I think it's important to remember that AI is a tool. It's up to us to decide how we use it and how we integrate it into our healthcare system.
So what's the key takeaway here for our listeners?
I think the takeaway is that AI has the potential to transform healthcare in profound ways. And while there are certainly challenges and questions to address, I believe that this technology can ultimately lead to better outcomes for patients and a more fulfilling career for healthcare professionals.
This has been an incredible deep dive so far, but before we get too caught up in the future of AI and healthcare, I want to come back to RadVLM and how it actually works. We've talked about the what and the why, but now I'm curious about the how.
You're right. We haven't really delved into the technical details yet. Let's unpack that a bit.
Okay, I'm ready to get a little nerdy. All right, so we know RadVLM is this amazing AI that can analyze chest x-rays and have a conversation about the findings, but how does it actually do that? It feels like magic.
It's not magic, but it's pretty close. RadVLM relies on two key components, a vision encoder and a language model. Imagine the vision encoder as the eyes of the system and the language model as the brain.
Okay, I can picture that. So the vision encoder sees the x-ray, and the language model interprets what it sees.
Exactly. Let's say you're looking at a chest x-ray. You see shapes, lines, shadows, all those visual details. The vision encoder takes that raw image data and converts it into a format the language model can understand. It's like translating a picture into a code.
And what does the language model do with that code?
The language model is where things get really interesting. It takes that code and uses it to generate text, answer questions, and even hold a conversation. It's trained on a massive amount of text data, so it understands the nuances of human language and can communicate in a way that feels remarkably natural.
So it's like the language model is reading the x-ray through the eyes of the vision encoder.
That's a great way to put it. It's this seamless interplay between the vision encoder and the language model that allows RadVLM to do what it does.
The paper mentions specific types of models they used, a vision encoder called SIGLIP and a language model called Quen2. Any reason why they chose those?
They likely chose those models because they've proven to be incredibly effective in other tasks involving both images and language. Think of it like building a dream team. You want the best players for each position.
So they picked the MVP of vision encoders and the all-star of language models. But there's one thing I'm still not quite grasping. We talked about visual grounding, where RadVLM can pinpoint the location of something on an x-ray. How does it actually do that?
That's a great question. It uses a clever technique where it predicts the coordinates of a bounding box around the feature in question. And gets this, it uses the same method it uses to generate text.
Wait, what? So it's treating the coordinates as if they were words in a sentence?
Exactly. It's a pretty ingenious way to unify the task of visual grounding with the overall language generation process. It predicts the coordinates just like any other word or phrase.
So it's like it's talking about the location of something on the x-ray, using the language of numbers.
That's a great way to think about it. And it really highlights how AI is blurring the lines between traditional boundaries like vision and language.
Okay, my brain is officially full. This is incredible, but I also want to make sure we're not losing sight of the human element here. We've talked a lot about the potential benefits of RadVLM, but how do radiologists feel about this technology?
It's a question that comes up a lot, and understandably so. It's natural for people to wonder about the impact on their jobs when new technologies like this emerge.
I can imagine some might be worried about being replaced by robots.
Of course. But I think it's crucial to emphasize that AI tools like RadVLM are designed to augment the capabilities of radiologists, not to replace them.
More like a partnership than a competition.
Exactly. RadVLM can handle some of the more routine tasks, freeing up radiologists to focus on the complex cases that truly require their expertise and judgment.
So rather than fearing AI, radiologists can embrace it as a tool that can enhance their work and even make their jobs more interesting.
Absolutely. Imagine a radiologist being able to focus on the most challenging and intellectually stimulating cases rather than spending hours on routine screenings. It could lead to a more fulfilling and engaging career.
That's a much more optimistic way to look at it. So what would you say is the key takeaway for our listeners today?
I think the takeaway is that AI has the potential to revolutionize healthcare, and specifically radiology, in profound ways. While there are undoubtedly challenges and questions to consider, I believe this technology, if used responsibly, can lead to better outcomes for patients and a more fulfilling career for healthcare professionals.
This has been a truly fascinating deep dive. I'm left feeling both amazed by the possibilities and humbled by the complexity of it all.
It's an exciting time to be witnessing these advancements. AI is rapidly changing the landscape of healthcare, and it's crucial to stay informed and engaged in the conversation.
And speaking of engagement, before we wrap up, I want to leave our listeners with a question to ponder. We've talked about the potential of RadVLM, but how comfortable would you be interacting with an AI in your own healthcare journey?
That's a great question. Would you trust its interpretations? Would you feel comfortable asking it questions about your health?
It's a question we all need to grapple with as AI becomes more integrated into our lives. Thanks for joining us on this incredible journey into the world of AI and radiology.
It's been a pleasure exploring this fascinating topic with you.
Until next time, keep seeking knowledge, keep asking questions, and keep diving deep.